Welcome back. Well, you can't stop time, but you can slow down signs that you're getting older, starting with your teeth. Here to explain how fixing your smile can take years off your face. Please welcome back Dr. Terri Alani. Hello. Okay. Teeth are one of those things, it's interesting that people just make judgments about somebody based on your alignment, the color of your teeth, all that type of thing. So when you talk about cosmetic dentistry, it can really impact someone's self-esteem.
So I have a saying, a beautiful smile speaks when you don't. And people really, they go to the plastic surgeon, they get everything done. Women are wearing fake eyelashes, what have you, but people forget the teeth balances out your face. So as we age, our teeth age with us.
Yeah.
They start to shift. You start to notice maybe in your 30s, 40s, up into your 50s, and on into menopause for the women. And one of the signs of aging, grinding. A lot of us grind our teeth. And what can happen is you grind, you wear your teeth down, so then you begin to show your lower teeth more, and it also shortens the distance between your nose and your chin, so it creates those wrinkles.
Yeah, and then of course color.
And it can also cause bone loss, it can cause chipping, and then of course some people will clench. Well, when you clench, it flattens the edges of your teeth, and the patient will also notice that it might push a tooth forward because you go into that pattern.
Yeah.
So there are a lot of things as we age, our teeth, we start to lose enamel, and that's why our teeth get yellower. And,
I thought it was the wine.
No, and whitening can help correct that. So we do lose a little bit of enamel every 10 years.
Wow, okay. And the teeth are one of those things that we kind of outgrow. I think our teeth did not intend for us to live this long, really.
Exactly. And now we can keep them forever.
Yeah.
I mean, as long as we live, we can keep them healthy.
Yeah, we know what to do. Okay,
yes.
Speaking of what to do, veneers. So veneers have been around a while, but there's technology has changed in veneers as well.
Okay, so with veneers, we do a lot of minimal prep, so we don't take very much tooth down. They're very, very thin. They're almost contact lens thin.
Right, right.
And they can change a lot of how your teeth look. So let's talk about, I think I've got some pictures, and we can restore them as far as the length. In this patient, they were grinding. You can see the two front teeth have been chipped. On the left and on the right, you can see we just restored with 2 veneers. And that's going to add the length back that you had. Now remember, as you get older, our teeth get shorter, and it makes us look so much older.
Yeah.
So we like to restore that length, and it all has to do with balance. In this particular patient, what we did is we ended up doing veneers, and you can see that we lengthened the teeth, and we did 8 veneers. Sometimes you need 8, sometimes just 2, sometimes 4. But we also whitened them. But this is the same patient.
Wow.
Look at the difference.
Yeah, yeah. All right.
Okay.
Major difference
then
here too.
In this patient, yes, we could have probably done Invisalign, but it's not going to get her the symmetrical smile that she needs. So not only do we get symmetry, we got a more balanced smile, and we corrected the discoloration and also some chips that this patient had.
Right?
Well, yes, this is done in 2 weeks. And for this particular patient, she wanted more uniform smile, and she wanted to correct the color and also close the gap. So veneers, everybody comes into me and they go, well, we have that dark line. No, we do metal-free dentistry. Porcelain veneers have no metal in them whatsoever.
Yeah, and again, I want to go back to the point you said, like, the old veneers, sometimes they would grind the teeth down a lot. Sometimes you do need to do some other type of prep.
Yes.
But for the most part with these, very minimal prep.
No, they're minimal prep. We also recommend that you wear a night guard. So veneers can actually take 10 years off of your age, because you need to have that balance. And then we do laser recontouring. So laser recontouring can be done if a patient comes in and they need minor adjustments. Gingival symmetry, or the symmetry of the gums,
gum
is
recession.
so important.
Yeah.
This isn't really gum recession. This patient had needed to have some gum removed.
Okay.
So on the left, you can see how the gum height is not the same. It makes the teeth look out of balance. So we all have asymmetries on our face, and what we do as cosmetic dentists is we look at the entire face and we try to create that balance and try to make the best out of asymmetry.
Because it looked like the teeth were kind of crooked, but really it was the gums making it look like they were crooked.
And this is right here, this is the most important slide because it shows you how the gum height should be. It's not even all the way around, and we have these zeniths. and how the parallel of each tooth. And so this is really important when you're creating that symmetry.
Yeah, all right. So, and the opposite is the gum recession, where it can make it look like you just have these super long teeth.
So gum recession, a lot of people think it's from brushing too hard. It's not. It's usually from clenching or grinding, and it's unsightly. And it also creates those little black triangles in between your teeth that you can see between the two front teeth. So basically, to correct this, either you could do Invisalign or maybe veneers, but you need to have this corrected because this is a sign of aging, which we can totally prevent.
Yeah, okay. Lip injections.
All right, so
she has something to say about this. Okay.
I get a lot of patients that have lip injections, and they come in and they want their teeth to show. Well, the problem with lip injections, especially if they're done too rigorously.
You have the duck lips?
Right. So they make the lips bigger, but they pull the lip down, and then they can create a gray shadowing, and they show less teeth. So I think I have right here, we did a snap-on smile on this patient to actually increase the length of their teeth because of her lip injection, she doesn't show the amount of teeth she's shown before. And I tell my patients, it's the lip injections, it's not that you're not showing enough teeth.
Okay. And if you see, I have the snap-on smile right here, and what's cool about this is that literally, when you say snap-on smile, that's what it is. Like, you have people who might have missing teeth or some, just other issues with their teeth. You can take this snap-on smile, put it right on top, and
literally, this is the coolest appliance there is. It's the most affordable option to have a beautiful smile that corrects spaces, gaps in place of a partial. You can whiten your teeth with it. It's amazing, and it's removable. And the cool thing is you only wear it when you want, and you can eat and drink with it, which you cannot do with any of the internet appliances. So this is the most affordable way to really give you that beautiful smile. This is before and after. This is a snap-on smile. These are not veneers. So it's pretty impressive.
Yeah, because I mean, literally, you pop that right in. You have people who've gotten through job interviews and things. And
yeah, it's incredible, and it's very functional.
Yeah. All right. Men have squarer, more masculine front teeth.
Yeah,
so there's a different look between.
Right. So when we're doing cosmetic dentistry, we really take each individual patient because it's customized. It's not one size fits all. So if you look at males, they generally have all four of their teeth are similar in size and they're square.
Right.
And as far as, and here you have a cosmetic case we did, but we didn't make the two front teeth very long because you want to have that masculine look.
But then, that mustache is helping with the masculine
exactly.
look.
It got grayer, didn't it? So with women, it's really interesting. A lot of women like central dominance. What central dominance means that your two front teeth are longer than the teeth on either side, and it's a much more youthful, feminine look.
Right.
One of the personalities, the celebrities that has that look is Julia Roberts.
Yep.
A lot of people like her smile. And so it's really just really customized based on each individual and trying to balance out, because when you grind and clench, you also lose volume in your cheeks and your facial profile. If you have an overbite, your lips are very thin, and also it can cause your chin is recessed, and it can cause that turkey neck.
Yeah. All right, so we know some people get nervous when they go to the dentist's office, but you have something to offset those nerves.
I sure do.
It's called Piper.
Come on, she's our Astros fan. Get up here, Piper. Come on up. Piper is the biggest Astros fan. She's our emotional support dog at the office, and if you come in, you'll get to meet her. We have a lot of patients coming in wanting Piper. If you're not a dog fan, then we put her in the back.
Yeah.
But she's very trained, and she's amazing.
Okay, let me see Piper's teeth.
Piper, show them your teeth. Come on.
Smile, Piper. Perfect teeth. There you go. All right. Terri, thank you very much.
You're welcome.
To make your appointment, call 713-621-5141, 713-621-5141, or log on to TexasToothLady.com. And don't forget to subscribe to her YouTube channel, youtube.com/Dr. Terri Alani. Now, Piper just gave you a good look in the face. If there's any dog that can lick you in the face, it's Piper, because I'm sure Piper's breath is amazing.